Hello, Dallas County. This is Abigail, your Community Health Administrator, and today I'm going to talk about what it means to be endemic. In public health, there are several terms that we use to describe the spread of disease. Many of us are familiar with the term pandemic, which means a disease is seen at an increased rate over multiple countries. This is where we've been for about the last 2 years. Where we want to be is at endemic spread, which is a constant, steady presence in a specific location or population. So let's dig into that a little deeper. With endemic spread, we want to see lower case rates, with significantly less people needing hospitalization or dying. There is no magic number, but rather is based on what our society deems a socially acceptable infection and mortality rate. With some diseases, we have said 0 is our ideal, and any cases identified constitute immediate action, like tuberculosis. Other diseases we see regularly and have accepted as part of our life, like influenza. We still have progress to make, however, in lowering our case rates of COVID-19. Endemic spread is going to be more predictable. So instead of the massive ups and downs we've seen throughout COVID-19, we'll likely see a more steady state, maybe with some predictable seasonal increases like we have with other respiratory illnesses. Endemicity does not mean a flat horizontal line, but rather a steady, predictable ebb and flow. While we're coming down from our most recent peak, we have not yet seen that steady state. It's too early to predict when that will happen, and oftentimes we acknowledge this by looking backwards at infection trends to pinpoint that start. Endemic spread is going to be more manageable. We already have many tools available to help us to manage COVID-19. We have accessible testing to help us identify infections in a timely manner. We have vaccinations to prevent infection, and we will soon have a vaccine for young children. We have pre-exposure prophylaxis to help further protect folks that are moderate to severely immunocompromised before they are exposed to the virus. And we have therapeutics to help reduce the severity of illness for people that do become infected. As these tools become more widely available, we'll be better equipped to manage any COVID-19 illness that occurs as a regular part of our health care. We have seen several respiratory illnesses spread across the global population and transition into endemic circulation. For example, the 1918 flu caused more than 50 million deaths worldwide. Over time, the virus became less severe, and we now have the tools to keep that fatality rate lower. As a society, we've accepted this level of infection and mortality as our norm. As I said, an endemic state does not mean 0 cases, a flat horizontal line, no harm, or no death. It simply means a steady state, with no crises, with no huge waves. We're not out of this public health emergency yet, but we're not in the same place that we were in March of 2020. We have many tools available to us, and we know a lot about this disease and how to manage it. What can you do to help us get to an endemic state? Help us to work to reduce the spread of the virus. Get all recommended vaccines, including your booster dose. Follow quarantine and isolation guidance to prevent further spread, and continue to wear your masks, especially in indoor public settings, to help reduce virus transmission. Pandemics end, and in time this one will too. To learn more about the COVID-19 pandemic, visit cdc.gov.